Hello and welcome to Health Matters on Channels Television. Thank you for being here. I am Mary Alale Yusuf. The World Health Organization believes that people on this planet can end AIDS as a public health threat by 2030, if everyone's rights are protected. This year, the theme, Take the Rights Path, My Health, My Right, is a clarion call to address inequalities standing in the path of ending AIDS. In 2023, an estimated 39.9 million people were living with HIV globally. About 630,000 of them died from HIV-related causes in the same year. There were also about 1.3 million new HIV infections. Sources say an estimated 13.9 million children between the ages of 0 and 17 lost one or both parents to AIDS-related causes in 2022. In the same year, about 84,000 children 0 to 14 died from AIDS-related causes, and there were 130,000 new infections in children. My guest is Director, Performance Management and Resource Mobilization, NACA, Dr. Yinka Falola Anoemwa. She joins us from our Abuja studio. You're welcome to the show, Dr. Falola Anoemwa.
Good afternoon, Nigeria. Good afternoon, Mary.
Let me start by asking, when HIV is no longer a public threat, we believe, we hope, we have faith that we can get there. But when it's no longer a public health threat, does that mean there will be no more infections? Or will it be reduced to a certain level? And what is this level?
Yeah, thank you. Yes, there is a global target, which is that by year 2030, we would have identified at least 95% of those who are living with HIV and put those at least 95% of those that are living with HIV on the life-saving antiretroviral drugs, and at least 95% of those that we have put on this life-saving treatment would have viral suppression. This means they will not be able to transmit the HIV even if they interact with people with their blood, because the virus will be very suppressed in their system. It cannot be transmitted. We believe we can achieve this because we are actually close to it. It does not mean HIV will no longer exist. It will be in people because they have it and they still have to be taking the life-saving medication to keep it low. We will still have need to tell them to do that. We will also have need to continue to ensure we do not transmit to the new generation, that is to children unborn, which is still a very big issue currently, as it were.
Okay, are you still asking people to get tested? Is it randomly, or, how often and where? What's the pattern of getting tested?
Testing for HIV is available everywhere. We even have self-test kits, which you can buy. That is not free. You can pick that up from the pharmacy, designated pharmacies. But HIV testing is available in all government hospitals. It's also even available in campaigns within communities. We also have primary health care centers that provide HIV testing services. This is very important for everybody to know their HIV status, especially pregnant women, because it is possible as a pregnant woman, even if you are positive, not to transmit the virus to your child when you are bringing forth the child. And this can only happen if you test and you do all that is required. You first know your HIV status and you do all that is required medically to prevent the transmission to the child. So testing is available everywhere, and it can be compulsory. It's offered as part of antenatal care in all government-designated centers for antenatal care.
Okay. Remind us of some of these inequalities and inequities that we are fighting in the HIV battle.
Yeah, there are a number of them because the stigma and discrimination still persists for those who live, who have the virus, especially women, because some of these times when women test positive, it's perceived as if they have brought it to the family. We still have a good number of cases being reported that they stigmatize these women when they know in the family that they are positive. So for this, people keep to themselves. They shy away from taking their medication. They avoid any situation that will make them know. Also, we still have this stigma and discrimination for children, even those living with HIV in schools. We still have work-related stigma. All of these, we have laws in the country that say HIV is not something that you can transmit to someone by living with that person, sharing regular living with the person, sharing, sitting together, eating together, and all of that. But people still discriminate and stigmatize. We still have work-related tests where people will make HIV tests compulsory, and because they have detected that the person is positive, they will tactically find a way to let that person go off work.
An underhanded way.
A number of things we are doing where people can report these cases. We have our toll-free line 622-6222 where you can report. We also have gender and human rights responsive response team in states where SACA, State Agency for the Control of AIDS, and within the Ministry of Health, and the SASCAP within the Ministry of Health, they take reports. We also have champions among the network of people living with HIV, women living with HIV, young people living with HIV, where you can link up with them and report so that such cases can be handled.
Okay. Maybe we'll be able to circle back to that, but I want to ask you now, according to the statistics, millions of children are orphaned every year because of AIDS-related causes. Their parents die. And a lot of them are underaged. What happens to these children? I mean, imagine children without parents, underaged. How do you handle these children?
So we have comprehensive care for vulnerable children. It's a robust care which covers actually what we have the document that is written by all stakeholders as led by Federal Ministry of Women Affairs, who has the mandate to coordinate this. And what that says is any child, vulnerability. In the document, we define vulnerability as in children, especially, of course, children 0 to 17 years are classified as children in the country, and that they must be, these children, all children must have access to health, education, and all social services, child protection, birth registration, everything that will make them develop to their optimum. Of course, orphans, especially those orphaned by HIV or by AIDS, are amongst those classified as vulnerable children. Definitely, it's not all children that are vulnerable, and it's not all orphans that are vulnerable. But for those who are unable to get this care within their family system, because even when the parents die, there are still family structure that take care of them. But in situations where this does not happen, they are to report. We have civil society organizations, NGOs, AON, we call them Association of NGOs on Vulnerable Children, who are within the communities. They work with the social welfare officers to identify and pick up these children. The ministry also provide care and oversight on orphanages to ensure that they provide all that every child would need to develop to their optimum as Nigerian children. Now, where we also have included amongst this classification children, street children, exploited Almajiri, because it's not all Almajiri children, or Almajiri system is not expected to make children vulnerable. But in situations where they are made vulnerable by the classification that they do not have access to health, education, and all other social services that will make them grow up well, they are supposed to report them to Ministry of Women Affairs in their states, and they oversight and ensure this is done. We have cases where children have been picked up and given to orphanages to care for, and we also have a lot of faith-based groups who support these programs in the communities.
Okay, so let me ask you quickly.
The Ministry of
let me quickly cut in there. It seems as if you lump all these children together, not just those orphaned by HIV and AIDS, but with other people. Is that how you keep them safe? Is that how you protect them from discrimination?
Yes. In care of vulnerable children, that's why we put all children. The denominator is access to care, access to education, health, and other social services. Like we know, HIV cannot be transmitted among children when they eat together, when they play together. It can't be transmitted with anybody on those bases. So to protect the children, we do not separate them. We expect that all children have access and are protected. They are supposed to also be in school. In situations where we have stigma because people get to know they are positive and they stigmatize them, or other children harass them, they are reported. And a number of times we give additional education to them, because what happens is that they do not really have full understanding of what HIV is, how it is transmitted, and how it is not transmitted. Most of these cases are resolved with additional education and alternative dispute resolution. A few cases have been taken to court and been dispensed or been judged in favor of those living with HIV, and all the what is supposed to be given to them are given to them.
Okay, in Nigeria, we estimate that there are about 1.9 million people living with HIV. That's from the NICE survey. How many of these people are children, or are children included in this survey?
Yeah, children are included in the figure. The figure for children, actually, we look at the number that we have been able to put on treatment, and we've been able to put about 1.6 of them, 1.6 million of estimated about 2 million people who are living with HIV in treatment. But we still have a huge gap for children that are supposed to be on treatment. Amongst children that are supposed to be on treatment, for adults, we are making between 80 and 85% of them. But for children, we are still at about 33%, which is far below expected figure of children that should be on care. And that is why the theme for this year was this day in Nigeria. Yes, Take the Right Path is the global theme, but we are localizing it by talking about sustaining HIV response and stopping HIV among children in Nigeria for us to end it by 2030.
That's a very tall order. Only 33% of children. Let me ask you, the HIV orphaned children, are they all infected, or are some free from infection?
It's not all children, all children that are orphaned by HIV that are positive. There are so many children, so many positive people who have gone, women who have taken the prevention of mother to care transmission care, and they did not transmit the HIV to their children. There are so many children of positive parents that are negative. amongst the children that are orphaned by HIV, yes, we have those that are positive among them. We also have a good number of them that are negative. Because science has shown that it's possible to be positive and not transmit to your children, or even not transmit to your partner. Because we have discordant couple who live, one is positive, one is negative, and they do not transmit the virus. So that's why the campaign is about women knowing their HIV status, and if they are positive, taking the life-saving antiretroviral therapy, prevention of mother-to-child transmission care, such that they do not transmit to their children.
Okay, at this point, we'll take a short break. Please wait for us on the other side. Welcome back. This is Health Matters on Channels Television, and we're talking about the right to health of HIV-infected persons. You can call 0808 054 2233 if you have questions about HIV, AIDS, transmission, and all that. You can also send a message at CTV_Mary A while the show continues. So, Doctor, please tell us, this wonderful antiretroviral medication that will prevent transmission to one's partner and prevent transmission to one's baby if one is pregnant, is it available in the country, and is it free?
Yes, HIV treatment is available in the country and it is free. We have the support of partners in doing this. PEPFAR of the United States government, Global Fund, UN systems, they support the country. The country to contribute to the pool to ensure we have continuity of medication to care for those living with HIV. And it is available in any government institution, and it is free. Of course, some persons who do not want to be in the public space, they also have in the private hospitals, and they make it available for them if they want to. So private health care facilities too do provide it. But it is available in government institutions and it is free. And it is expected that it's for lifelong. Even where you have been on the treatment, it is expected that you have viral suppression. And when you have viral suppression, that means the HIV is not so much in your system, in your bloodstream again, and they might not even be detected. So we call it U equals U. It is undetectable, untransmissible. So when you are on the medication, the virus becomes very low. It cannot be detected. But you have to continue to take your medication for life to keep it at that level. HIV is like any chronic disease, like hypertension, like diabetes, that you have to take your medication and you stay fine under care.
All right. Apart from people voluntarily walking in to get tested, do you have other strategies to convince people to know their status and start treatment? Because we have to get to these children who are under the radar. Any other strategies?
Yeah, we have campaigns. We make it actually part of care when people come to health facility to request for other health checks. HIV is one of the tests that is conducted. We also run campaigns. It's also everywhere around ANC where people go for antenatal care. The challenge we have is that so many people, they do not actually go to health facility for antenatal care, women that are pregnant. They still go to faith-based, people still go to traditional birth attendants. We are working with all of these institutions to reach the pregnant women wherever they go for care, so that we can identify at least 90% of those that are positive put them on care, and stop transmission to their children. HIV test is also, there's also self-test kits you can pick in the pharmacy, just like the pregnancy test, and there is the guide of who to call. You talk to pharmacists, they will direct you to where you can get tested. So it's available. And then when we run World AIDS Day campaigns and engagements, a lot of activities around this, civil society organizations integrate HIV testing into all other health checks that are run in the communities.
Okay, so we've established over the years, and you just said it again, that HIV is not casually caught. You don't get it from sitting with people, from eating with them, or playing with them. And there's even medication that suppresses it to non-transmissible. My question now is, why is there still stigma? What is this? What is that thing that is causing this stigma?
I guess what we used to hear is more like fear. Fear which will translate to be false evidence appearing real. People don't actually get to know updates about facts. They still deal with myths and misconceptions. So they are afraid. And also there is the feeling that, it's only people who have done something wrong or have illicit sexual acts that contract it and all of that, which is all false, like they are myths, because we know HIV can be transmitted through blood, it can be transmitted through sharing sharp objects. Of course, the largest number is still through sexual transmission, but we also have mother-to-child transmission of HIV, which is even huge for us now because so many children who are even young adults now in their 20s, even some in their 30s, HIV came in 40 years ago, got it through when they were born, through their mother, through their parents. So it's a lot of false evidence appearing real, fear out of that is baseless really, and that's why we encourage people not to stigmatize, but to get to know facts about HIV and also adhere to ABC of prevention, which is abstinence when you are young before you get committed in a relationship, and when you are committed in a relationship, be faithful to your partner, and condom use to prevent, and also do not share sharp objects. We know all these are routes of transmission, but people do not really care, and they also feel because it's no longer in our faces like it was before, or like COVID was, people have pushed it to the background that it doesn't exist again. It does, and it's still killing people. So many people are still dying from it, and children are being born with it. So for us to actually get to that stage where it doesn't exist again, we all need to do our own bit, do not do all of those things that can transmit it, and show care to those who have it. Because if we show care and we normalize it, people can take their medication, they are not afraid, they have viral suppression, they can live, they can marry anybody, they can live without transmitting to other people. But where we stigmatize, we are actually fueling the spread of the virus.
Thank you so much, Dr. Yinka Falola Anuema. It's been a wonderful meeting with you and very eye-opening. Thank you so much for coming on the show.
Thank you, Mary. Good afternoon.
And thank you, viewers, for being there and listening in. Let's stop the stigma together so that we can reach the 2030 goal and we'll stop the spread of HIV. I'm Mary Alale Yusuf. Enjoy your day.